Welcome back to We Do the Heavy Lifting. I'm your host, Dr. Jenny Yentis, and today we do rehabilitation. What do I mean by that? Well, our guests today are a physical therapist and an athletic trainer, both of which work in college athletics, and I'm really excited for a two-part episode. So we're going to have one part where we talk about how they got into their jobs, and then you're going to have to come back for our second episode, which is going to talk a little bit more about what their day-to-days are like. So our guests today, I'm really excited. We're both HD13 speakers. So you came and talked at Hilliard Discussion, and now they're back again to do a podcast. We have Mr. Saul Luna, who is currently an athletic trainer at Texas A&M University, mainly works with track and field. And I'm gonna proclaim you an expert in dry needling. That was the topic he spoke about on Hilliard Discussion. It got rave reviews. We also have Dr. David Regan Suarez, and you're currently at Rice University as the head physical therapist for all of the sports, and you also are associated with Houston Methodist Hospital. And you've had quite the career of even helping physical therapy. You did a residency here, Texas A&M University. You were at Memorial Hermann, so you've had a lot of experience as well. So thank you both for being on with me today, and let's get into it, shall we? All right, so I guess my first question is to both of you is, how'd you end up in, like, let's say athletic training? So Sal, how did you end up pursuing athletic training? What was it that triggered your interest in that field particularly?
So I grew up in South Texas in a small town, San Diego, Texas, and so my brother tore his ACL, and when he was he went to PT and went through the whole process, but then he got to the point where he was done with his PT. And so then when he tried to get back into doing what he loved, there was no one to help him, And so my pastor, he was a former student trainer at a junior college, so he had some experience, so he would help him out. And we also had a gentleman, one of my teammates' dads, who also had some trainer experience, and he would also help out. So for me, it was like, man, those two guys are cool, and they're filling the gap, and they're helping my brother, and I want to do that, and that's kind of what got me interested. That's what even I was like, what is this? What's this sorcery? They were doing, they're just helping, and I think that's really got my attention, is just being able to meet somebody where they're at and helping them.
That's awesome. Thank you for sharing that. And Regan, what about you? How did you get into or what sparked your interest in physical therapy?
Yeah, so I grew up in a small town in South Louisiana as well, and then my background is in combative sports, so like wrestling. I actually had 2 orthopedic surgeries myself, so an ACL and a shoulder surgery. And at the time I was going through rehab, there was a well-known NBA player going through rehab and posting videos, and this is like the emergence of YouTube and Twitter, and I saw he was doing rehab, I was doing rehab. I thought I was a high-level athlete, and we were not doing the same thing. And so I just got that wanting to know the why, and kind of wanting to understand why he was doing what he was doing and why I'm doing what I'm doing. What's even the difference between the yellow band and the black band when doing shoulder exercises? I want to know that why. So that brought me to PT school in Houston, and in the Houston Medical Center, there's a lot of opportunities to network and do other extracurricular learning, I guess. And so that's where I sought the residency and then the fellowship here at Texas A&M, and that's kind of what landed me here and then at Rice.
Well, thank you for sharing as well, and I hope everything has healed, and it's been a few years for you, but I hope all is good now. So my question comes in, it's going to be, a lot of our listeners are going to ask, what's the difference between physical therapy and athletic training, and then how do you work together? So I don't know which one of you wants to go first. Regan? Oh,
Money?
Saul?
Money?
No.
Money.
If you want to make big bucks, go be a PT, right? But so basically, an athletic trainer, we're first responder personnel, right? So we're boots on the ground, and we're the ones that are dealing with our student athletes in a day-to-day basis. And so our job is to prevent, treat, and rehabilitate injuries. And so whenever one of our student athletes suffers an injury that we are not able to help them through, then that's when we have to take advantage of our network. So here at Texas A&M, we have an amazing network of physicians, sports psychologists, nutritionists, sports science. And so we now can, dip into our network to try to find a solution to whatever issue our student athlete has. So with regard to PT, right? So then we send them to our team physician. Our team physician determines that they need PT. They write the PT referral. And so then we go ahead and accompany our student athlete to meet our PT. We now are able to leverage their expertise to help our student athlete get from where they are to where they want to be. And so thankfully, the PT is also my boss. So we're able to really just collaborate, and then she can tell us what she needs us to do. So now we're really taking care of things because, like in my brother's situation, he'd go to PT. Well, guess what? That's only for maybe 30, 45 minutes a day, twice a week or whatever, right? So now, because we work on the same staff and work with the student athlete together, now our student athlete can get comprehensive care all throughout the week.
Yeah.
And to add to that, I think Saul, like said, the collaboration piece, and that's the main thing, and especially in like a high performance setting such as here, where we have that ability to network and be collaborative amongst each other and learn from one another, all for the health of the student athlete, versus being siloed and bucketed in our own little worlds where we're not able to collaborate. And that's when the student athlete doesn't get the care that they need. But being on a team and being able to collaborate, I think, is the key piece of that.
That's really interesting that you say collaborate, because it a lot of times people see an athlete performing and they don't know. We were just talking about behind the scenes here at the podcast, but behind the scenes of their performance as an athlete. And there's a lot that goes into that. You mentioned nutrition, sports science, physical therapy, athletic training, the team physicians. That's outside of the coaches. Mm-hmm. And that's a whole nother aspect. So there's so much to integrate. So Regan, I'll ask you, so when you go and you have an athlete with an injury that you're trying to do some rehabilitation with, who all is sitting at the table? Can you give an idea of what that collaboration looks like and how you make a decision for treatment?
Yeah, so there's a total team behind it, and there's people who aren't sitting at the table immediately, but then they have to get talked to as well. So in a rehab session, it's you and the student athlete. But then outside of that, it's you, the student athlete, and the athletic trainer, those same people with the strength and conditioning staff, as well as with sports science, the coaches, the parents, the student athletes, friend group, and then you have academics on top of that. So you try to have a checklist of people of who you want to collaborate with each and every day. An interesting thing is being here, you have 17 different sports, multiple athletic trainers, so you have to reach a broad variety of people for different sports. And that's the fun part. That's the networking and the collaboration and integration piece, which is fun. But from a day-to-day basis, it's you and that student athlete and trying to really get to know them and understand them and how they operate and how they think and what their barriers are is one key piece of that rehab process that can be hard, but also the greatest thing to learn from.
I can only imagine what some of the barriers are for each individual athlete, and then trying to navigate that and then helping them through that. That's got to be pretty rewarding. So when you're doing athletic training, I think most of our listeners probably think of athletic training as taping ankles, but it's so much more than that. Can you talked a little bit about your first responder, you prevent, treat, respond to. What does that look like? What does your day-to-day kind of look like on I don't know, are you just taping ankles?
See, and I'm so thankful that you asked that question because I do tape ankles.
Okay.
I'm also a weatherman right now. We're monitoring the lightning situations because we have a team practicing. My intern is over at the track, and he's watching practice, right? So we also have to be cognizant of that.
Okay.
And but I also have to make sure that the Gatorade is not too sweet, or I got to make sure that it's just not blah, right? Because why? If the athletes don't drink it, then they are underhydrated, and then that can create problems, But that's not all. I also have to be ready at the drop of a dime to grab my AD and maybe do CPR.
Okay.
And so our job it's multifaceted. We have a ton of responsibilities. And also, so most physicians go through medical school, and then once they're done with their medical school, then they pick their area of focus and they go be residents, right? So within athletic training, right? So there are athletic trainers who work as physician extenders. They work alongside physicians in their offices. There are athletic trainers who work along PTs in their office, right? And so you can choose your area of specialty. You mentioned dry needling earlier, right? So one of my mentors, one of the things that he said to me that really stuck to me is you gotta know it well enough to teach it, right? So whenever I got introduced into the world of needling, I wanted to be so good at it that I'd be able that I understood it, that I'd be able to teach it, And so I've chosen to specialize in soft tissue therapy and assessment, and all the toolbox that goes along with that. So, thanks for asking. I appreciate that, because yes, I can help you get bigger muscles also, right? Because people think that's what you do, right?
Well, I mean, people have a misconception of what probably a physical therapist or athletic trainer, even a coach, does on a day-to-day. But I think when you talk to people, or the general consensus is when you ask them what an athletic trainer is, one, they'll either mistake it for a personal trainer, which we've had a podcast on that with Dr. Sherry Walters. So we'll put a link to that in the show notes. So if you're curious as to what the difference is there, you can go back and listen to that podcast. Or they think you just tape ankles, or they know you as the person that runs out on the field when somebody goes down. They think you're the first one there. So like you said, you're a first responder. So typically, but there is much more to that.
And I think if I were to use one word, I would say facilitator. Right. So my job is to facilitate. And so if you go look up the word facilitate, one of the synonyms is accelerator, right? So whether it's accelerating the healing process, the rehabilitation process, whether it's trying, I made an appointment with the doctor for a month from now. No. Let's talk with our network.
Yeah.
Yep.
Hey, we got you in. Oh no, I got to go get a breathing exam done. I can't get. Aha, we have an ace up our sleeves, the Huffines Institute. We'll take care of you. We'll get your, right? And that's the thing, is being able to leverage the resources to accelerate the outcome, which is our student athletes being their best.
Yeah.
Absolutely.
To add to that, I think other than being like someone who is extremely versatile, like Saul said, in many different settings, there are the people also talking to the coaches. So they're also having to be a spokesperson or an MC, if you will, because they're having to talk to the coaches, whereas a physical therapist in this setting is not always going to be talking to the coaches. I'm talking to Saul to pass messages upstream or downstream, wherever they need to go. And so that's another thing to add to their versatile plate. So
like a lot of different jobs, you're kind of, jack of all trades at that point. You have to be able to do a lot of little things, even outside of just being a first responder and having to care for an injury and rehab and prevent and all of those other
I was
things.
going to say Swiss Army knife, but that's Anais Smith's.
I like the
name,
Swiss
so
Army knife.
I don't want
like
no
that.
smoke, Anais, okay?
So Regan, let me ask you about becoming a PT. So a lot of our listeners are students in the program or students throughout the world, and some of them may want to have that job. So a lot of them can figure out how to become a physical therapist. How do they become a physical therapist in sports? And then on top of that, college athletics?
Yeah, I get this question frequently as well. I think one thing I didn't know I wanted to do this and I just found myself here. I like to start with that. I do have a lot of undergrad students say, I want to be in the NFL, or I want to be in the WNBA as a PT. Like, that's what I want to do. And I'm like, well, I think you should go through PT school and kind of find what you do. There's been some amazing people. PT encompasses a lot of things. So neurology, wound care, even acute care. So people who have just day surgery in the hospital, they have to get them up and ambulate them. So there's administration, research. There's a lot of facilitators to PT comprehensively. And so that's one thing that I think people should go through. With sports, the emergence of the residencies and fellowships have been taking a big jump here recently in the last few years. So now we're starting to see more of these residencies, and the difference between just someone who's graduated PT school and their residency, you get that extra mentorship, and that's the main thing of that. There's different pillars and leadership and research as well, but you get mentorship, so advanced clinical acumen. And then a fellowship is where it's really dialed into the specificity of the Division I collegiate setting. So it takes time. A lot of it is networking, in right place, right time, right people.
Yeah.
But a lot of it also is kind of exploring that route, doing good where you are currently to kind of make sure you get that next step. In the next 3 years, there's going to be even more opportunities. And so people who are wanting to get into it now, I think start low, start working with, Texas A&M football, Texas A&M track and field. Just getting out there and being around athletes. And if you can just learn how to talk to collegiate athletes, you're a step further than a lot of other people. So,
Okay. So for those students kind of trying to become, there's these jobs that you can get as a team manager,
Right.
as a student, and you can work then with the team. And then you're learning how to talk to coaches, the athletes, all of those folks. Now, I do want to ask one clarification question. You were talking about residencies and fellowships. Now, you can get a PT or you can get something called a DPT, which is a doctor of physical therapy. Is the difference then that residency or fellowship, or what makes the D?
That's a great question, and I think it's like a historical thing. I think I know there's PTs out there who aren't doctorates of PT. There's still people who have bachelor's or master's out there. So if you don't see a DPT, they might not have their doctorate, because that came in like 1997. It's kind of newer. But people who have DPT is someone who's graduated from a doctoral program of physical therapy. Residency, though, the people that distinguish by that is, are you a board clinical specialist? You can do a residency or you cannot. So you might see OCS, orthopedic clinical specialist, or SCS, which is a sports clinical specialist. That might indicate someone who has done a residency or some higher level of clinical acumen in that area, versus just someone who has not and done it. So that's one unfortunate thing about the physical therapy world. It's really confusing, and people have questions, and I think that's great to try to understand that, but hopefully we all get on the same page with that. So
I think these fields also are changing ever so often. I mean, athletic training, Saul, I don't know your background, but I believe now you have to have a master's to sit for boards, correct? And so can you talk a little bit about how that's changing with the field, what it takes to become an athletic trainer and how that has changed or is changing?
Yes, ma'am. So when I got into it back in the old days, it was, it was the apprenticeship model. So, like kind of like in the movies where you go find a master and then you ask him if he'll take you on. He says no, you got to prove yourself. And that's kind of what happened to me, right? I told you I came from a real small town, didn't have any experience, any credentials whatsoever. So then I come up here and I walk into the athletic training room here at A&M and, hey, I'd like to be an athletic trainer. And there wasn't any room for me. And so the answer was no. So then I call my dad and I'm like, Dad, A&M's not going to work out. He's like, why not? I said, well, I came to be a trainer and there's not any room for me. He's like, okay, well, you got to stay up there. What? I don't. What? So then, and then of course my pastor was like, man, don't give up.
Yeah.
And so then I went back in October, which was, now I know, middle of football season, bad time, right? So I go ask and no. So I go back in November, but this time for whatever reason I left my phone number, and then the answer was no. And so then I'm supposed to go home, on a Wednesday after finals, and for whatever reason I couldn't go home till Friday. I was really bummed out about it. And so then, I woke up Friday morning and my phone rings at 10 a.m. And it was the head athletic trainer, and he called and he said, hey, we had a problem with one of our students. Can you come in? So I dressed up and ran from the Southside Commons to Kyle Field.
Yeah.
And there was my opportunity to, quote unquote, walk on, right,
Yeah.
and be an athletic trainer. So and then of course I spent the next few years being mentored and learning directly under the eyes of the masters. So now you actually can get a master's degree. How cool is that? To say you're a master of athletic training, like that'd be fun, right?
Yeah.
And so now you actually go through a 2-year program, intense. You get doctorate level hours, but you only get a master's. I think they're taking, it's like 80 something hours or something like that.
Oof.
And so anyhow, but now they graduate and they have a degree and a master's degree in athletic training. You get it done in 2 years.
That's so for our listeners, as Saul said, a doctorate is usually about 96 hours, I believe. And so to do 80 hours in 2 years, and it takes usually 4 to 5 years to do those 96 hours, and you're saying they're doing 80 in
Yeah.
2 years.
Mhm.
That's
Or-
intense.
or something. Yeah.
They start in the summer though, usually, correct?
Yeah,
Like a program will go. They don't get the summers off like some of these
Yeah.
other programs.
Yeah, it's really, but so that's kind of how it is now. And so now, and with that education, they can become state licensed. So here in the state of Texas, you can have a license in athletic training.
Okay.
But then nationally, you can be nationally recognized by being nationally certified in
Okay.
athletic training. So in those 2 years, you get both of those qualifications.
That's pretty impressive. And then that allows you just to go straight into work, which is pretty great. I mean, the same thing happens usually for a physical therapy. It's 2 to 3 years post bachelor's as well. So it's, yeah, you've got a job when you're done. I think sometimes a lot of people go and get a degree and then they end up doing whatever because there's no job.
To Saul's point, there's a lot of power in the word no for some people, and there's a lot of resiliency can be brought, but it brings you sometimes the best opportunities. So.
Yeah, absolutely. So I was going to ask both of you, I mentioned it earlier, if you could think of one pro and one con to being a physical therapist or an athletic trainer, what would that be? Regan, I'll start with you.
The pro, I would say, is the ability to, as a physical therapist in general, just the ability to network, learn from people. I've got to learn a ton from Saul, especially dry needling. Like you said, he was an expert. I agree with you there. But the ability to network, critically think, and then also get that still patient interaction or athlete interaction and find them at their highest and their lows. I think that's the beauty of it for me and a lot of people out there. The con, there's I love what I do. I think sometimes just it depends on what system you're working for. It can be hard. Like some PTs we here at A&M, we saw one athlete one-on-one with them and worked with them until we saw another. At some systems, especially like a hospital system or a private practice setting, you might see 5 or 6 patients an hour, and that's 8 hours a day. And that's a large volume, and that can be that's where a lot of burnout happens. So I think figuring out what works best for you and where you're happiest is going to get you the most benefit, as well as your patients or athletes or who you're working for.
It's a good point. I don't think a lot of people consider that when they're considering that as a career. So what would you say would be a pro for athletic training, the job, and then what's a con? Because I think a lot of our students don't know the downsides, and it's important for us to tell them, both sides. So.
Well, so first of all, apologies to our listeners. It's 60 hours.
60
hours. So we're talking
all
here.
right.
I Googled, and
All
But anyway, so I'm
That's
sorry.
okay, 60.
But anyway,
That's
2
okay.
years, 60 hours. All right. So a pro is you get to be behind the scenes. So that's the thing. So I worked with Olympic gold medalist at Mo, right? So everybody sees the gold medal and the smiles, right? And like I talked about during my little talk, but nobody knows everything that went into that gold medal, right? So you get to be a participant on that journey with your athlete and help them go. You ride the highs, you ride the lows, and you get to be there for it all. So for me, because that's something that personally drives me, is helping people be successful, right? So I find that incredibly rewarding. But definitely a con. So you got to remember that I came up in the old days. So I started out as a high school athletic trainer. So in Texas, at that point in time, the biggest level of high school was 5A. So I had a 5A high school by myself, And so you want to talk about hours, you know what I mean? Like the worst day, the longest day I ever had was I clocked in at 7:30 in the morning. I clocked out at 1:30 a.m. Right? So I would argue that perhaps something that people don't know about is just the hours that go into it, right? Because we have to prepare the athletes and help them get ready to perform. But then we got to be there afterwards to evaluate and assess any problems that may have come up. And then also sweep the floor and clean up and mop, all those things that put the bleachers away, I dropped my popcorn, got to go do that, and those are some of the jobs that athletic trainers get assigned, as part of our role. So pros, you get to see all the good stuff and you get to be behind the scenes. Cons, the hours.
Yeah. There's something that I've heard just working in college athletics in general is the hours it's a lot of dedication and there's quite a bit of pressure there. So for our listeners that are thinking, that would be a great thing to do. I would love to be there. I'd love to be, it's persistence, perseverance, and then you just have to be ready to work and long hours. One last question for each of you. If you had to give a piece of advice to a student thinking about going into your career, what would it be? Whoever wants to go first.
Yeah, I would say be open to taking feedback, positive or negative, and building off that, and then be as versatile as you can. Like, don't just want to do one sport your whole career, because there's things that I've learned from track and field that have helped me with working with volleyball or football. There's things I've learned from football that has helped me with even baseball or other sports, wrestling in comparison. So be as versatile as you can and take something from every little place that you go and combine that to your toolbox and help kind of just create the perfect storm of a clinical acumen. Meanwhile, taking that feedback, I think, is key.
So?
How good do you want to be? Because if once you are able to figure out the answer to that question, then every other action that you take, you can base it off of that answer, right? Because the bottom line is, if I want to be in the, if I want to work in Regan setting and work in a collegiate setting, well then, I got to prove that I belong there, right? And so that's the thing. You don't get to be in the collegiate, you don't become, so instead of worrying about being a PT in a collegiate setting, why don't you be a PT, a collegiate level PT at whatever setting you're at, right? And then whoever they is, will find you, and then you'll get your shot, So how good do you want to be, and figure out what it takes to be that good, and then go for it.
Well, thank you both so much for joining us today. I really appreciate it. And for our listeners, stay tuned, because we are going to have a part 2 with Saul and Regan, and we're going to talk a little bit more about actually treating athletes and what goes into that. And as always, if you have questions or comments, you can reach us at huffines@tamu.edu. And as always, stay healthy, stay safe, and we'll see you next time.